breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
All right, everyone, welcome back to this week's episode of Brainstorming with the Docs. I'm Dr. Kolby Condos, my co-host and colleague, as always, Dr. Glenn Harrison.
I'm looking forward to this one because these are some technology that you just picked up. So
yeah, it's going to be interesting. It's cool. It's exciting. I like it. It's fun. Really passive, so people get a lot of therapeutic benefits without a whole lot of effort, which I think is always kind of really cool for people. So today we are going to talk about hyperbaric oxygen therapy, more specifically mild hyperbaric oxygen therapy. If this is your first time listening or watching and you like it, please hit like and subscribe and turn on notifications because we're going to continue to roll out new content each and every week. And hopefully you find it interesting and applicable to you. So without further ado, let's talk about hyperbaric oxygen therapy.
Yeah, well, I'm going to let you spearhead this. So, you talked about two different types. You want to briefly kind of give a summary of what these two types are?
Yeah, so basically hyperbaric oxygen therapy chambers are broken down into two basic types. One is like a hard chamber, and these are the type of chambers that you would see in a hospital setting. And what it is it's a physical hard chamber. It's made of a hard composite material. And they actually put you in this chamber and they flood you with 100% pure concentrated oxygen under pressure.
Is that something that we would be using up in high altitude here in Colorado?
You could. They can use it for like decompression sickness associated with scuba diving too. Sometimes. The thing about these chambers is they are only in hospital settings. And the reason being is because A, it's really hard to get oxygen, like hospital grade oxygen. Two, is because when you have something that has 100% concentrated oxygen and it's under pressure, it's not necessarily flammable, but oxygen is a big time accelerant. So when you go into something even like a hard chamber, you say you have like a really severe burn, they'll use them in burn units too. You have to go in, in 100% cotton clothing or naked because they don't want to build up any sort of static electricity that might discharge inside the chamber.
Oh, wow.
Right? So that's the first type. The first type is the type that has a hard line of oxygen that goes into it, and you are flooded with 100% concentrated oxygen under pressure.
And what's the second? What's the second kind?
The second kind is called mild hyperbaric oxygen therapy, and that would be like a soft chamber. That's actually what we purchased. This is more prevalent in non-hospital settings. And what it does is it actually uses a compressor that compresses atmospheric air. And then you have a oxygen concentrator adjunct to that pumps in oxygen through like a cannulus, which goes in through your nose. It's like an oxygen mask. Okay. And, so it's a lesser mixture of oxygen, but you still receive like immense therapeutic benefits.
So what does that look like if someone, because you have one in your office now, when somebody comes in, what does it look like? How does it work?
Yeah. So it's really pretty straightforward. It's a soft chamber that zips open and closed. Usually they have a series of zippers to help accommodate like the tightness of the chamber so you can add pressure to it and it doesn't bleed out. And what it is these chambers have pressure relief valves. So the patient climbs in, they lay down in the chamber, they're zipped into the chamber. The concentrator and the compressor is on and it slowly builds pressure up. As you're in it, it almost feels like if you've ever driven in the mountains where there's, changes in altitude, your ears pop a lot and stuff like that. That's kind of what it feels like inside the chamber.
Okay.
And then once it reaches a certain PSI, it's got a pressure relief valve that bleeds off excess pressure. So it keeps that chamber at a constant, like in my case, it's 5 PSI. So it keeps that chamber at 5 PSI. And when your body is inside that chamber under pressure, it actually allows you, and you're in the presence of like excessive oxygen. So in this case, it's like 94% concentrated oxygen and atmospheric air is blended together. When you're inside the chamber, it actually allows that oxygen, the increased oxygen in the air around you, to dissolve into tissues other than just attaching to red blood cells. So what that means is that not only does it increase the bioavailability and the binding capacity of your red blood cells through hemoglobin, but it actually can dissolve into your plasma and into other tissues as well. So you'd think that if you have, say you have an acute stroke, and there's a lot of swelling in that area. Say the red blood cells and all that stuff can't get through. Well, plasma's a smaller, they're smaller structurally than a red blood cell. So if there's oxygen dissolved in that plasma and it's still getting through because it's able to sneak through areas that are super inflamed and swollen, then it's going to aid the recovery process and the healing process. So I mean, it dissolves into all sorts of stuff. So that's where it's so cool and it's so diverse, because you can use it for a lot of things.
Yeah,
right?
it's not specific.
No, I mean, it can be used for stroke. It can be used for, say you have acute low back pain, it can help with that. You say you're post-surgery on a knee replacement,
Yeah. Any kind of immune problem. Like where I'm in Colorado, we're Denver, a mile up. Every autoimmune disorder is worse at this altitude. And I see a lot of autoimmunity, and we'll get people to go down to sea level for like a month or 2 weeks or whatever they can do. And we see a lot of their symptoms lift because of lack of oxygen, reduced oxygenation. So yeah, any immune problem would probably would benefit from these types of therapies.
Yes.
What are some of the things, highly, we talked about this before, but anything that why a person would not want to use?
Basically, there's two things that I've come across that are like, one is an absolute like no, and that's if you have like a pneumothorax or that's a collapsed lung.
Yeah, you would know.
Yeah, you broke a rib, punctured a lung. Definitely don't go sit into a chamber that is going to force more air out of your lung, right? Mm-hmm. Number two would be in certain instances with diabetics, you've got to be careful because it can actually lower their blood sugar.
I did not know that.
Yeah, so something you need to be aware of.
Okay.
But it's a super useful tool. I actually am like a little bit infatuated with it right now because I've used it myself and I stinking love it. My energy is better when I do it. I sleep better when I do it. I just feel this overall feeling of, vigor and vitality when I use it regularly. So big fan.
Wow. And we talk about immune problems and, tissue injuries, a lot of neurological components, right? Because it's, the brain is neurologically dependent or metabolically dependent on oxygen.
Yeah. I mean, your brain needs three things to basically function, and it's, activation, energy, and fuel in the form of oxygen. Mm-hmm. So if you can add more than, if you can add multiple of those, so say you perform specific targeted exercise and then you sit in the hyperbaric chamber, well, you just knocked out two of the three, right? Exactly. Eat a balanced diet, you got all three.
Yeah. And again, I keep referencing Colorado because there's some people, a lot of people come to Colorado and Denver and they don't have any problem with altitude, but there's a lot that do. And or they're just training and they're trying to exert themselves more. So what do? They're using oxygen to recover. Sometimes they're using oxygen to train back and forth. So around here, we're seeing more and more oxygen therapies. They're kind of popping up all over because of the benefits of them. But using it as a tool, I guess, I think that would be the most important way of looking at it, right? Like so far in your clinic, what have you been, telling a patient this might be helpful for you?
I used it today for someone who had suffered like a whiplash injury and also had like a traumatic brain injury. So it was a car accident, whiplash, TBI. So used it as an adjunct therapy. That wasn't the only thing we did. We obviously did a bunch of other stuff with them, but really beneficial adjunct therapy. I've used it for, the possibilities are limited. Post-surgery, I've used it with people like, you're going in there and you're going and breaking up adhesions around a joint or something, and then you stick them in the chamber and that'll help, the reparative processes in the scar tissue. I mean, there's absolutely a ton of applications. Your imagination is kind of the limit.
Yeah, I even had a friend in Colorado Springs, and she worked at a clinic, and they had a few units, and I think her daughter, was having some attention challenges in school. It actually changed. The teachers were commenting constantly after that. What did you do with your daughter? She has more attention, more focus.
I mean, yeah,
mood changes.
I think if your brain's starving for oxygen, it's kind of a big deal, right? You make a lot more energy in the presence of oxygen than you do without it.
That's right. And if you're not getting oxygen in for whatever the reason, you just can't heal. you can't
Yep.
recover. Then it
Yep.
turns in this vicious negative downward spiral.
Mhm.
So I think that's kind of all I had on this, but I think it's really interesting, and maybe we can revisit this again. Maybe talk about some case studies that you had in the clinic so far.
Yeah. I think I mean, it's still relatively new in my office, but I'm pretty excited about it. So, I mean, if you guys have questions, you can obviously reach out to us. Our email associated with the podcast is info@brainstormingwiththedocs.com. You can find a lot of interesting literature online if you just look up mild hyperbaric oxygen therapy. There's a lot of research, a lot of resources out there. There's pages and pages and pages of studies on this stuff, from burns to diabetes to diabetic neuropathy. There's a ton of applications. So if you're interested in it at all, make sure you hop on Google and, type in hyperbaric oxygen therapy treatment options, or, and it'll come up. There's a ton of them.
If you're in the Minnesota area, just go see
Yeah, you
Dr.
can come
Kolby.
check it out, or call me, and you guys can find my contact information on the website. Mine is northlakescheropractic.com. Dr. Glenn's is drgharrison.com. And yeah, again, if you have questions, let us know, and we'll keep rolling out new content like this as we keep adding modalities. I guess we'll explain them to you. So if you liked it, let us know.
Yeah, that sounds good. I look forward to the next one.
All right, buddy. Bye-bye.
Bye-bye.